The father, because of the passivity and depression of the father, could cause issues related to unconscious guilt and destructive behavior, which again in relationship with other women could come across as getting involved with a woman and then become self-destructive to themselves and sabotaging the relationship because of the guilt that they suffered with regard to the relationship and perception of the relationship problem that has been going on in between the son and the triangle of son, mother, and father. And then there's a lot of other combinations and variations involved. Other children are involved. How many children are there? Is the son is the firstborn, daughter is the firstborn, or how many children are there, and the interaction between the children is a very complex issue. However, again, the fear of intimacy and the problems related with the intimate relationship and achievement of this relationship comes to play if there are traumas at the Oedipal phase, which again could cause problems at the workplace, which is people who are not able to achieve appropriate ability to go for an interview, and then if there's a place that they go and it's very easy to get in, especially at situations like there's a looking for a job in a position of a company that is very weak, and then at the same time having the fear of going for the interview and the fear of being rejected, and then that fear and problems related to that causing more setbacks for the person in the business world, besides the relationship with a woman and a man. So the interesting part of the fear of intimacy again does not work on the relationship of men and women with each other, or men or women and women with each other. So basically it works symbolic representation of the relationship of the human being with the world outside. Now the world outside could be represented as mother or father figure, and then the child, the person relationship to this world then could be again an interaction between how he perceived his mother and father in childhood. Now, after all this theoretical, analytical, and historical discussion, what should we do to take care of that, right? Yeah. The issue with how to take care of that is very extremely complex. However, the more we feel confident about ourselves as a human being and satisfied about ourselves as an individual, we would be able to incorporate a mother and father in ourselves, by ourselves, the good father and good mother, an attentive father and attentive mother, incorporating into ourselves, then to feel cared for and satisfied, and then after becoming more strong and self-satisfied and self-esteem getting higher, then we would have a better relationship, a less feared relationship in our environment. One of the ways I would suggest to achieve that is basically I would tell my patients, and people would discuss that with me, that if we don't have anything, we have our body, our hands and legs and limbs. Hopefully if we have it, that will be very important. We have to have it. So when we have it, in order to achieve that kind of sense of satisfaction, I would suggest walking without any need to go and do anything and buy anything for anyone, buy anything even for ourselves, do anything for anyone, not to walk and go to the bank to cash a check for our husband or wife or daughter or son, not that. Just walking for the sake of only walking, to move our body around throughout the space. Now that, if we have a appropriate set of timing, and then the frequency of that to be set, and a good way to make that timing and the budget, usually 3 times a week, and the minimum amount of walking should be set as a set budget. Could go more than that, but